Hi, next we're going to talk about the reference section of the Traumatic Brain Injury Toolkit for healthcare providers. And it is the first section of the toolkit, and there is a table of contents that starts it to give you just an easy way of glancing and seeing what's in it. There are 14 documents in this section. I'm not going to go into a lot of detail on them, but I want you to know what's there, and I'll give you some highlights about them, and then you can look at them more within the toolkit. The first thing that's there is the concussion management protocol. We wanted it right up front so that you take a look at it. There is a separate video on this, so I'm not going to go into it again, but again, we want you to be looking at this, and please look at that other video if you haven't taken the full training. Next in the reference section is a link to the pediatric guidelines for mild traumatic brain injury in children, and there are 5 key recommendations that the CDC wanted you to really take out from those. They are here. Do not routinely image patients to diagnose MTBI, and in these guidelines, they're using the term MTBI, and they are suggesting that we use that term instead of concussion. On our pages, we use the words interchangeably. We know that people haven't really switched away from the word concussion, and enough people now know what concussion is that we want them to understand that the concussion is that mild traumatic brain injury. It is a traumatic brain injury. The next one is use validated age-appropriate symptom scales to diagnose MTBI. Keep in mind, there isn't one for under 5 yet. We're hoping that one will be available soon. Assess evidence-based risk factors for prolonged recovery. They're in there as well. Provide patients with instructions on return to activity that are customized to their symptoms. And then counsel patients to return gradually to non-sport activities after no more than a 2 to 3 day rest period. So this is a change. This after no more than 2 to 3 days of rest. We used to kind of have this idea that we put people in a quiet, dark room for as long as their symptoms lasted so that we weren't provoking their symptoms and making things worse. What we know now is that that will actually prolong symptoms. So this guideline is now saying 2 to 3 days, and then we really need them back into their daily activities at a level that they can tolerate, but we do need them back and engaged. So this information, link to the guidelines, is there in the toolkit. Next in the reference section are 4 out of 5 supplemental documents to the guidelines. There's a return to school letter, but that is in the send home recommended section. So the other ones are at a glance versions. I call them cheat sheets. And there's one on diagnosis, one on prognosis, one on treatment and management. And then there's a checklist for physicians to kind of go through all of the best practices. There are also mild traumatic brain injury guidelines for adults in there. That's the next document. The Tennessee Return to Learn, Return to Play guidelines are there with information about Tennessee's sports concussion law, the steps to return a child to the classroom as the first step, and then there's a gradual return to play plan, and that is at the end of those guidelines. And it's really important to think about when you are returning a child to support them. Some things that you might want to include is that the athlete reports no remaining symptoms, right? Because that's all we can know, is that they're reporting no symptoms, and that the athlete's been warned of the dangers of returning to sport while symptoms persist. We want them to know about that so that if they're not being forthcoming about their symptoms, they understand what the dangers are. And of course, that danger is second impact syndrome. It happens rarely, but it's when that catastrophic swelling happens when you are still experiencing symptoms from the first concussion and you return and get a second concussion, and the result can be catastrophic. So we just want them to understand that. And then you may want to help them to understand that that they're being cleared to participate in the Tennessee's gradual return to play plan, which means sending them back to school and telling that school that you would like them to use this gradual return to play plan, which is 6 days of amping up physical activity and making sure that there are no symptoms. So those are all things that you can include in your documentation and into the letter back to the school. Next in the reference section is a flyer for our program, Brain Links, and this you can hand to the parent to give to the school so that we can come in and train the school. The school can contact us, and you can give us the name of the school, and the parent can be involved in that and decide whether we provide information about that patient or not, that student. They can also, these can go to providers in your area. Let's say you live in a rural area, you have a speech pathologist that you use a lot for other things, but they don't really understand traumatic brain injury. We can come in and help them to understand. They can come here to this site and learn more about concussion and traumatic brain injury and how it might be different for them working with a student. The next thing in the reference section is a sample 504 and IEP accommodations and modifications listing. It is a great, we love this one put out by the Center for Brain Injury Research and Training out of the University of Oregon, because it just breaks things down into nice categories. So you can think about, on the one side, it has things like, what can we do teaching-wise that can help the student? How about assistive technology? Things like that. How can we handle the student in transition from one school to one class to another? On the other side, it has cognitive domains. So if you know that the child has attention difficulties or organization difficulties, there are accommodations that are listed right for that thing. So if you're familiar with accommodations, it's a good thing just to look at to make you think of other things that you might be using that might kind of add to your repertoire. And if you have someone who's going back to work, there's the Job Accommodations Network flyer for work accommodations. There's also a link on the table of contents page. So the Job Accommodations Network flyer is within the toolkit, within that section of the reference section. The link to the brain injury specific accommodations at the Job Accommodation Network is on the table of contents for the reference section. Next is information on the 6 types of concussion. Please watch that video for more information about it. Here, I just want to let you know that this document is here in the reference section, and it goes through the 6 types of concussion. On one side, it's a great infographic by the University of Pittsburgh Medical Center. You can take a look at it in the toolkit. And then on this side is our summary of some of the interesting information about it, the takeaway facts, like under the facts section, symptoms will be broad and generalized during the first week following concussion and will generally include symptoms like headache and fatigue. And then it'll break down into one of the 6 clinical trajectories or types later after that first week. And that the other real big takeaway is that there are active treatments that are very effective for these different types of concussion. So it's really important looking at that concussion management protocol to make sure that we're referring for these treatments. At the concussion management protocol says 4 weeks, but if we need to do it earlier or at any point, we can do that. We can also do it after if someone comes back with issues later on. And then the final 2 reference tools, there's a link to the CDC's online training for healthcare providers, and you can get 2 free continuing education units for the training, and it's a really good training about mild traumatic brain injury. And then the last thing is the research summary and references, and that really is, it's a really easy to read document on the support that backs up why we put this toolkit together in the first place, the gaps in the literature. We tried to fill all of those gaps in identification and referral and patient education, things like that. And then it is also the research summary that is support for the concussion management protocol. It was really the gaps in the literature that drove the creation of that protocol, because if we use that protocol, it will be really, really changing the way that we are treating our folks in our state with concussion, mild traumatic brain injury. So lots of great information there, just an overview here for you, and I hope that you'll take a look at it and use it with your patients. Thanks so much.